8:11 now, Steve and Ted in the morning here on KNSS. On a Wednesday morning, that means it's Wednesdays with Dr. Wagle. When Dr. Jason Wagle with the Kansas Perio and Dental Implants. Good morning, sir. Nice to have you with us this morning.
Good morning, Steve. How are you doing today?
We're doing very well. Now, you're a specialist in periodontics and the perfect person to answer this question. How does someone know if they are at risk for periodontal disease?
You know, periodontal disease, also called gum disease, can show up in just about anyone, but certain people are at higher risk. For example, older people who are at the highest risk actually for periodontal disease. The CDC reports that over 70% of Americans over the age of 65 have some form of periodontitis. In addition, other risk factors include tobacco use, which may be one of the most significant risk factors.
So it's one more reason not to smoke, right?
Yes. People can decide to quit smoking or not begin smoking, but another risk factor is genetics, which people can't control. However, we can use a simple genetic test to determine who is more likely to develop gum disease, and then use this test for early intervention to help them keep their teeth for a lifetime.
Are there any other risk factors you want to talk about?
Yeah, there are a few. There's some other risk factors, such as stress, which lowers the patient's immune system, and there are other medications that might increase a patient's risk as well. A person's diet can also be a factor, and a recent study showed that the lack of adequate sleep can compromise the immune system to increase a person's risk for severe gum disease.
Oh, okay.
I should also mention, which we've mentioned before, that diseases such as diabetes can also make it harder for a patient to control gum disease.
How do you assess risk when someone comes into your office, a patient?
Steve, at Kansas Perio, we always take a complete medical history. We do a thorough exam, and we offer patients treatment options to improve their oral health. And that helps us get a pretty good result.
Do you get good results then, most of the time?
Yeah. Yes, we can, Periodontal disease is preventable and controllable. With professional treatment in our office, regular visits to the dentist, and good habits at home, such as daily brushing and flossing, patients can show great improvement.
All right. And what should our listeners do if they have questions about gum disease then?
Visit our website at kansasperio.com or call us and make an appointment to get the information specific to your situation.
All right. Thank you, Dr. Wagle. Wednesdays with Wagle, brought to you by Kansas Perio and Dental Implants. And when it's time to get serious about your smile, go to kansasperio.com. Their phone number, by the way, 685-2731. 8:14 now, Steve and Ted in the morning here on KNS.